Hi, my name's Joanne Bass. I'm Education Specialist at OET for Europe, Middle East and Africa. Dean is from CapitalNurse and we work together on the Living the Language pilot programme.
CapitalNurse is about getting nursing right for London, as well as Capital Midwife and Capital AHP. So our vision is to make sure we have the right workforce to deliver excellent patient care. To deliver excellent patient care, you need good communication skills and effective communication skills. It was really key to work with OET as part of this pilot, because we had identified there had been some communication challenges with our internationally educated AHPs.
And the workshops were delivered for 5 weeks and they were 2-hour sessions, so there were 5 workshops in total. And they were all delivered online on Microsoft Teams, and it was led by myself as the teacher. So the Living the Language workshops were actually based on the Living the Language guides, which we have already for doctors and nurses, and they're designed to help healthcare professionals once they've arrived in country and they might be dealing with those communication and cultural challenges once they arrive. So they focus on 3 different areas, so social communication, workplace communication, and patient communication. So we designed these workshops around the existing Living the Language guides. The workshops were designed to help internationally trained healthcare professionals to feel confident in their clinical communication skills after they've taken the OET test. Some of the skills that we looked at were adopting a person-centered approach, demonstrating empathy and active listening techniques, and all of the skills that a healthcare professional would need in the workplace to give quality patient care.
So feedback by participants has been actually brilliant. They're able to practice in the clinical areas, and that's been feedback from managers and the participants themselves. They feel a lot more better prepared to handle real life situations in the clinical environment going forward.
So one of the great things about the workshops was that it offered a safe space for internationally trained healthcare professionals to share their experiences and their challenges that they've experienced in the workplace. Participants felt that they had increased confidence levels following the workshops, and they felt better prepared to be able to handle difficult situations with patients and encounters with their colleagues as well in the workplace. So it really showed that they'd benefited from the skills that they'd learned.
I'm really excited about this programme continuing, and the part it's going to play really on our internationally educated nurses, midwives and AHPs journey. I think collaboration is key, and I think our professional relationship to continue is going to be fantastic. An internationally educated nurse, midwife, AHP journey doesn't end when they first arrive. The journey continues, so I think having programmes such as this will benefit them for many years to come. So looking forward to what the future holds and what that brings. This workshop shows a delivery of good pastoral care. We know that if we look after our internationally educated nurses, midwives and AHPs, that they will stay with us in the UK and continue to deliver excellent patient care.
We already know that OET helps prepare candidates for the workplace, and there's that real impact that the test has in terms of the clinical communication skills that it teaches. But we also know that language learning doesn't end there. And so these workshops we hope to continue so that they can support healthcare professionals beyond the test and further into their professional careers.